Loose skin after Wegovy or Zepbound does not mean weight loss damaged your body. Wegovy contains Semaglutide, while Zepbound contains Tirzepatide. The looseness comes from size change, not skin damage. It appears when fat loss leaves behind more skin than can tighten smoothly, even when weight loss was gradual. How much it takes to trigger this varies from person to person. Time, strength training, and stable weight can improve your shape, but creams cannot remove a hanging fold. If you want a large fold removed, surgery is usually the only option. Skin is living tissue, not shrink wrap. Collagen gives it strength, while elastin helps it stretch and spring back. When your body stays larger for years, this support system remains stretched. After major fat loss, your body can shrink faster than stretched skin can adjust. Wegovy and Zepbound make this mismatch visible by reducing body size. The same problem can follow weight loss surgery, dieting, illness, or any other large weight change. How much your skin tightens depends on more than the number on the scale. Age, genetics, years at a higher weight, pregnancy, smoking, and sun damage all affect how well skin springs back. Even a younger person can develop loose skin after major loss. The location changes what you notice. Abdominal skin may form a lower fold. Upper arms may hang when lifted. Thighs can rub, breasts may flatten, and the face or neck may look suddenly older. A common mistake is calling every soft area loose skin. Remaining fat feels thicker and fills the fold. True excess skin often feels thinner, wrinkles easily, and pulls away with little padding underneath. That distinction matters because fat loss and skin removal solve different problems. More weight loss may reduce a thick, padded fold. It can make thin excess skin look more obvious because less fat remains beneath it. Once you know the area is truly loose skin, give your body time after weight loss slows. Skin can keep adjusting slowly, and your shape may look better after months at a stable weight. Time helps most when the looseness is mild. It cannot reliably erase a heavy lower belly fold or other deep hanging skin. Resistance training is often worth adding because it improves the shape beneath the skin. Building muscle in the shoulders, chest, legs, and buttocks replaces some lost volume. It can create a firmer outline without shortening excess skin. It also helps preserve independence as you age. Picture two people at the same weight. One loses muscle and looks smaller but softer. The other preserves muscle and looks more defined, even though both have similar skin elasticity. The difference comes from the tissue beneath the skin. Choose strength work that matches your joints and fitness level. Progress slowly and train major muscle groups consistently. Exercise improves function, balance, and body shape, and that improvement in shape is the real goal for your midsection. Protein supports muscle and tissue repair. Severe calorie restriction worsens weakness and muscle loss. Once your nutritional needs are met, protein's real job is building and repairing muscle, not tightening skin. Nutrition supports muscle. Total weight lost, previous body size, age, and years of stretching matter more for skin tightness than your weekly pace. Rapid loss can make the change look sudden, but pace alone is not the deciding factor. Regaining weight to fill the skin is not a real fix either. The fold may look fuller, but you lose some health benefits from the weight loss. Skin appearance should not push you to abandon effective obesity treatment. Repeated losing and regaining can stretch the same tissues again. A steady, maintainable weight protects your health progress and any future cosmetic result. The better goal is protecting the healthier body underneath the fold. After your weight stabilizes, you may turn to hydration. Drinking enough fluid supports health, and moisturizer can make dry skin look smoother. Neither creates new elastic tissue or removes the extra surface area left after long-term stretching. Firming creams usually produce subtle changes at best. A moisturizer plumps the surface temporarily, and a vitamin A cream improves fine texture, Those surface effects are what creams are actually good for. Collagen powders are marketed like replacement parts for loose skin. Digestion breaks collagen into smaller pieces, and studies mainly measure skin moisture and small changes in stretchiness. They have not shown that a supplement can remove substantial hanging skin after major weight loss. Compression garments help with rubbing. They improve comfort during exercise and daily activity and protect tender folds under clothing. Think of compression as comfort support, not a treatment. The next step depends on excess skin, remaining fat, and whether your weight is stable. Mild looseness may look better with time and added muscle. A heavy fold causing rashes or limiting movement needs a different plan. Severity is not measured by appearance alone. A fold becomes a health problem when it limits walking, makes hygiene difficult, or stays damp despite care. At that point, your goal changes from appearance to comfort and skin protection. Seek medical care if the skin cracks, drains pus, smells persistently, or develops spreading redness. Fever or increasing pain raises concern for infection. Until you are evaluated, keep the area clean, dry, and protected from friction. If the looseness is mild and mainly cosmetic, a non-surgical treatment is worth considering. These treatments use ultrasound, radio waves, or lasers, and they slightly tighten mild sagging. They work best on fine, mild sagging, not thick folds. Before you pay for a device, match the promise to the problem. Fine looseness around the neck or upper arms differs from a large lower belly fold. Neck and upper arm skin responds better to these devices than a large abdominal fold does. If you have substantial excess skin, surgery physically removes it. The operation depends on the location. Options include a tummy tuck, arm lift, thigh lift, breast lift, or lower body lift. Surgery is the one option that physically removes the fold itself. Surgery creates scars, requires recovery, and can cause bleeding, infection, pockets of fluid, poor wound healing, or blood clots. Larger procedures may need to be split into separate operations. Risk also rises with nicotine use and poor nutrition. Most surgeons want your weight to remain stable because further loss can create new looseness. Significant regain can stretch the result again. Good nutrition, well-managed health problems, and avoiding nicotine support safer healing. During a consultation, ask where the scars will be and how long recovery takes. Ask how they manage pain and swelling afterward. Before and after photographs of similar patients can clarify realistic changes. A board-certified plastic surgeon should review your medicines, nutrition, and blood clot risk. Decide whether the area is fat, loose skin, or both. Protect muscle, eat enough, stabilize your weight, and allow time before judging your shape. Use compression for comfort when rubbing is a problem. Wait for stable weight before choosing skin tightening treatment or surgery. Use creams for moisture, not promises. Use exercise for strength and shape, not skin removal. Consider procedures only when the severity matches the likely benefit. The goal is realistic improvement, not a perfect body. Wegovy and Zepbound can reveal loose skin because successful fat loss changes body size. That does not make your treatment a failure. The best response depends on the fold itself, not the strongest marketing promise. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor